Okay, everyone, today I am joined by Dr. Peter Martone, and I'm excited to chat with him because we are going to talk about sleep, sleep posture, and all the different health issues that it can lead to. You guys know that I love talking about root causes or underlying issues, and we know that a lot of times, things that might show up in our children's life or in our life, it isn't just that thing. It might not just be um, you know, ADHD or other things that are happening. Usually there's some underlying things that we can look at or turn to that you might not be hearing from your pediatrician, or you might not be hearing from conventional people that you're talking to. You guys know that I've talked a lot about having to advocate to find answers for different things for my kids, for myself. And so that's what we continue to try to do on this podcast as well. And why I'm so grateful for Dr. Martone coming on today to dive into this with us. So thank you so much for coming on the podcast.
Well, thank you so much for having me, and kudos out to you for taking your mental equity in your brain and being able to share that with the world to be able to make such a difference. I love and commend people that do this. So
Yeah, thank you. Well, I'd love to start with what exactly do you do? And how did you get into the work that you do?
yeah. So you ever see the book, The Zigzag Principle? I have definitely zigzagged to where I am today, but I really zigzagged because of trying to fix my own health issues that I had. So I'm in my undergrad world, I'm an exercise physiologist and a kinesiologist. So I love the study of human biomechanics, so how the body moves. And that led me into chiropractic, where I worked on patients at the time when I decided to enter the sleep industry. I was working on patients for 15 years, and I always was helping people, achieve an optimal state of health and well-being by aligning the spine, helping them get out of pain. But I always had back pain myself. I had back pain from when I was a kid all the way up to when at 15 years ago I herniated my disc. So I blew out my L5 disc in a mountain biking injury. I I'm a ADD type of individual, so I crave adrenaline, in order to scratch the itch. So I take a lot of risks, my poor wife. And I kind of jumped off this little rock and I twisted wrong and I tweaked it. But I always had back pain, so I never even like chalked it up. I'm a good justifier. I can help other people with their spines adjusting them, but I couldn't help myself with my own pain because I put it up to, oh, it's, I'm a mountain biker, I'm a competitive athlete. Yeah, it's I can help everybody else, but my pain's normal because I'm too active. Well, then I herniated my disc, blew out. I remember telling my wife, "All right, I got to go to the emergency room." She was like, "What? What's going on?" I'm like, "I can't move." She's like, "All right, I'll take you." I'm like, "No, you don't understand. I can't move." And I tried to move out of position. So I'm screaming in pain. They asked my wife in the emergency room if I was a drug addict because they gave me so much morphine and I just was in intense pain. My entire leg was numb. And like I was like, what the HEW hockey sticks has my life come to? I'm in the emergency room trying to keep people out of here, but I myself am a chiropractor lying in this bed. So that was not a great place for me. But what I did do, in having ADD, you can see patterns. So I knew that there was a pattern, and I had to fix my spine. So I started reviewing X-rays. I take X-rays on patients, and I reviewed 3,000 X-rays, and I found the pattern. The pattern is, as we have forward head posture, right? We're texting all day long,
Yeah.
we're on computers all day long, and you have this forward head posture. Your posture is a battle between your neurology and gravity. So I started reading posture, and there are adaptive changes that happen to this forward head posture. And in 90% of the cases, you get it's called a psoas major muscle, which is through your abdomen. It spasms to twist the hips to take pressure off of the lower back because of the forward head posture. Actually, dural tension is what it's doing. And the psoas is the only muscle in the human body that attaches directly to the disc. So I had all of this back issue. I was getting it adjusted. I have all of this hip issue, but it was due to forward head posture. And I slept curled up in a ball because when you're ADD, you like to feel comfortable and protected. So I summarized, if I could get my neck arched back for 8 hours that I spend at night changing my sleeping position, I should, in theory, be able to improve the curve, release that spasm, and take pressure off of my disc and heal my own disc. And fast forward, through about 8 weeks later, the numbness was completely gone. And now I have no pain and I'm still back to my crazy lifestyle. And it's because I changed my sleeping position. So, now fast forward 24 years later, I now travel the world teaching people how to sleep.
Wow, that's so interesting that you said that because I actually had a chiropractor about probably 2 years ago, maybe like a year and a half, 2 years ago, tell me, he's like, has anybody told you that like you need to spend more time looking up? And I was like, no. And he told me that he's like, okay, well, just like at some point during the day, like if you are watching TV or something, like be it in a position where like your head's up and you're not like looking down. But nobody had like ever mentioned that to me before. But because of what he said, I actually do that with sleep because I was noticing with sleep, especially, I have 3 kids, 3 and under. So I've been in the like breastfeeding, co-sleeping stage for over 3 years. So like it's so easy to like be in an uncomfortable position with your head down, but his words have like stayed with me. So I always like fix my head and I put my head up when I sleep instead of like tucked down. So it's very interesting. I feel like, wow, I'm doing something right. But so what are the other effects, I guess, of like that sleeping posture? And why is it like so important? Because like not everybody has that psoas pain. Not everybody's getting that. But like, are there other areas that it could like potentially show up?
So absolutely. And I'm one of my specialties within practice where people would come into me with a lot of autonomic dysfunction. So they wouldn't be able to get pregnant. They would have hormonal imbalances. They would have autoimmune issues. They'd have breathing issues. The kids would have asthma. And all of these are related to a dysregulation in what's called the autonomic nervous system. It's a balance between the sympathetics and the parasympathetics. They're the two systems. Your sympathetics are your survival systems, and your parasympathetic are your thrive systems. So survive versus thrive. And during the day, you should be sympathetic dominant, surviving. And at night, you should be thriving. And as long as you have a good balance and healthy regulation between those two systems, you're not going to have an issue in the three systems that are affected when the thrive is suppressed: immune system, digestion, and reproduction. So as the head comes forward, what it does, it affects the nerve behind me called your vagus nerve. So loss of cervical function suppresses vagal tone, which gives you dysregulation in that autonomic nervous system. So people that have hormonal imbalances, their night sweats are getting bad, they have issues with their digestive tract, they have issues with their immune system. Normally you have an issue with all three systems, and you go out there into the medical world and you try to, oh, what's my immune system issue? Oh, I have, I have diverticulitis. Oh, I have these. And they're looking at them all as separate problems. When you really look at the 350-foot view, it's because you have cervical neck posture due to your poor sleeping position, which is causing suppression on the vagus nerve, which is 80% of all of the function to that thrive nervous system. So most people have some sort of like hip issue or they got a knee issue due to that misalignment, but a majority of the people pick it up with internal health issues.
Yeah, I mean, I have knee and hip issues, so
So watch this. Do me a favor, okay? So you
yeah.
see how I'm pointing to my camera? Make a circle and then
Hmm.
look at me right through that camera. Make a circle with your hands and then bring that back to your eye.
Which eye? My right or my
Just
left eye?
whatever eye you want to.
Okay.
See what eye you looked at me with, right? That was your
Mhm.
left eye.
Yeah.
So now you can put your hands down. Are you right-handed?
Yes.
Okay, so let me give you a little bit of explanation about your avatar. You internalize stress, typically. You're an internal thinker. you can't shut your brain off. So when you can't shut your brain off, it's an anxious state. So you typically have a brain that needs a lot of spin where you internalize anxiety. Not you specifically, but you're typically going to be your worst critic and always compare yourself to others. Now, that individual, when they sleep, typically they need safety to fall asleep, and you're going to have an issue in three areas: immune system, digestive system, and reproductive system. Your head tilts to the side of an old ankle sprain normally. So I would say that you've sprained your right ankle at some point in time, which restricts your range of motion to the left side, and then your hip's going to go out to the left side also. So that's like your typical avatar. Normally when you read that, neurology is what's going on.
That's super fascinating because all of those things have happened. That pretty much describes me. I'm a huge internalizer, definitely my own worst critic. I think a ton, but I don't like necessarily always say it outwards. And I have actually sprained my right ankle several times, having to use crutches once or twice with it. So
yeah, and your ear's gonna ring on the right side when you fall asleep. Sometimes your hands will fall asleep, but later on down the road, you're young now, but you'll start to get heart palpitations because of that dysregulation in that autonomic nervous system. So just to let you know, that's the neurology just looking at you that we can read, and then you can you back in a solution, and that solution starts at night when you're sleeping.
wow, that's very interesting. Wow. Okay. So you can like see this, I guess, like too, just like by looking at people. So then you help them like find a good sleep pattern, and that's going to help like prevent some of these things later down the road, or like undo stuff that's been done. Explain it a little bit more to me.
Yeah, this is great. So we can look beyond people's symptoms and tell them what's going on before before they even know what's going on, right? So we don't even at this point now, we don't need it to look at intakes. We take intakes and put them face down. So we read what's going on with you, connect with the patient, and then we back in a solution. So consistently knowing how neurology responds, most people are doing the same thing. They're on computers, they're on cell phones, they're watching TV, they're sitting in chairs the same way, they're at computer jobs. So when you look at that as a whole, you need to do more with your time in bed, right? You need to do more than just waking up recharged and well rested. I guess our branding is how to get way better sleep, waking up, awakening the full potential of a well rested, aligned you. You want to focus on alignments when you sleep to reverse the damaging effect of our modern day lifestyle. And really what we focus on is what's called a 10-minute sleep ritual. And you are not in control, although you and I, because I'm cross-dominant also, love to be in control. One of the toughest parts about falling asleep is you have to give in and let go to the subconscious brain. And that letting go, there's a lot that it's easier said than done. And in the sleep ritual is about letting go, allowing the subconscious brain to feel safe, and then making the body feel aligned and not in pain, because the number one reason you toss and turn is because your body's in pain. So as you look at the sleep triune, we set you up in a 10-minute sleep ritual to give your body the best chance of success.
That's super interesting. I feel like the season of life I'm in right now, I don't have a hard time falling asleep. I'm probably just like so exhausted from motherhood that I hit the pillow, and I usually don't have a hard time falling asleep.
Do you wake up in the middle of the night?
I don't, unless my kids wake me up. If my kids, obviously they wake me up, but usually not ever. I guess maybe I'm so used to maybe waking up in the middle of the night that if they sleep longer than normal, I might kind of wake up and be like, look at the monitors and be like, okay, everybody's okay, and I can go right back to sleep.
Where are your covers when you do sleep? Are they off of you? Are they on you? Are they on the floor?
They're not on the floor. They're usually, I feel like, on me.
Okay. Unless
it's hot, I guess. It's getting hot here, and we haven't like fully kicked on our AC, so we're just trying to deal with the heat. But When I was single and I lived by myself, I used to fold back my covers, crawl into bed, and I would get out in the morning and just fold my covers back because my bed was like perfectly made. And then when I got married, I don't know what happened. Like it's a tornado. So, well, even the other night I went in to nurse my son and I came back in the room and one of my husband's pillows was like flown across the room. So he's a very active sleeper. I'm less active. But when I'm pregnant, I really struggle with sleep. I get the sleep insomnia in the first trimester. I get it again in the third trimester. Pretty much as soon as I'm pregnant, my left psoas starts really bothering me. Like I'll limp. I'll be like, my husband's like, you can't even tell you're pregnant yet and you're limping already. And I'm like, I know. So like I have to get like chiropractic care throughout all of pregnancy because I don't know what it is like with my hips. And
What
since I was
position
pregnant,
do you sleep in when you're pregnant?
usually, well, I'm normally either a back sleeper or a left side sleeper. Um, and whenever I use a pillow with my legs every time. So if I'm on my back, I have it like toward the bottom of my legs. If I'm on my side, it's in between my knees. But yeah, when I'm pregnant though, I can't really sleep on my back either. So
You can, you just have to sleep elevated.
right. So I have a hard time getting comfortable like in pregnancy and my hips bother me as soon as I'm pregnant. And I've had a little bit of hip issues since. Right now, they haven't like really been bothering me I'm at like 6 months postpartum, which is great. But if it ever does
And
flare
it's your
up,
left hip, correct?
yeah, it's my left side.
It's usually opposite the side of your head lean, which you typically are leaning to the side of an ankle sprain. So yeah, it would be your left
Interesting.
hip that's reactive because of the psoas is reacting. So that's why you have the hip issue. And
Yeah.
then what happens is you wear down that labrum.
Yeah, that's so interesting. Yeah. But I could see how like obviously how you sleep is playing into other areas of your life. So I'd love to kind of talk about um, you know, like what does sleep like really affect because there's so much um between like a proper sleep posture connected with like children. Let's talk about kids for a little bit with child's behavior, focus, mood, rest, overall wellness. Um, like as I mentioned in the beginning, things like ADHD, obviously not just, there's not like one thing that's just the answer, like, but sleep could play a role. I actually have somebody in my life right now whose kid was not sleeping great, had so many underlying like issues that they finally figured out. Well, they just thought that she had ADHD. She was always just like throwing tantrums, really just struggled a lot. She's like 6. Ended up having some like adenoid issues, some other things, and got things fixed. And now she's sleeping with like her mouth closed. She's sleeping soundly. And like all these other things are disappearing from her life. And they just thought she was a tough kid. And come to find out she had underlying issues, which is like so sad because you want these kids to feel their best and they don't know what's going on. But sleep is a huge piece of the puzzle. So I'd love for you to kind of speak to that a little bit when it comes to our kids.
All right. So you and I both have ADHD brains, okay? Which is a brain that
How do
requires,
you know I have an ADHD brain?
trust me. So, so it's just a brain that requires a lot of spin. That's all to stay focused. It requires more things going on than the average brain. That's all the ADD brain is. So now when you're looking at ADD, so let's go back to 1978 when I was falling asleep. I was always told go to bed. Never taught how to sleep. Go to bed, go to bed, go to bed. Well, I would go to bed. I lived in Malden, Massachusetts, on a busy street where there was a bus stop right in front of our house. And I can still remember thinking that, and people would come and bang on the glass on the window on my front porch, scare the heck out of me. I could still remember falling asleep scared every night because I thought somebody was going to bust through that window and steal me, right? As a child, think about that. And So how did I sleep? I slept. We put people into avatars, whether a gorilla or an armadillo or you're an ostrich. But I slept like an armadillo. My shield around me curled up, and then the ostrich in me, it put all my stuffed animals around my head, and I would just fall asleep and then end up on the floor, end up on the side of my bed. And this is a lot of kids because we are trying to fall asleep to feel safe, and we fall asleep with our conscious brain falls asleep with our subconscious brain in mind. Our conscious brain thinks we're comfortable. We're not comfortable. Comfort happens with the body in alignment. We feel safe, then you're able to fall asleep. So you have to look at creating a safe environment for a child, regardless if you think it's safe environment, it's how that child's internalizing, and then you can put that child in any position that you want. So with my daughter, who had a very difficult time, we co-slept for a lot of years, and it was really tough for her to be able to go into her room, and we had to find out why. The number one reason you're going to find an issue with the child is because they're scared,
Yeah.
right? There's something's wrong. Well, what did I do? I went all the way back, to when I was a child, knowing how afraid I was, not realizing why I became a side sleeper, which most people do because of safety. And I said, all right, look, here's your turtle. This turtle, let's give it a superpower. It's got a shell. This goes on your head. Nothing can get through that shell. Okay, here's your tiger. Your tiger's going to be at the front of the bed. It's going to be, it's going to be the watcher. And if anybody comes in, the tiger's going to attack. So we gave superpowers to every stuffed animal on her bed. Bang, she started falling asleep. And then we started making her fall asleep with the pillow on her head. This one's, my youngest daughter's 17 years old and still falls asleep with a pillow on her head. I fall asleep with the pillow on my head because I am falling asleep in a position with the body in the position, the body's in alignment, which is on my back like this, but that's an unsafe feeling for the subconscious brain. So I have to create safety for the subconscious. So we got to use pressure on our chest, pressure against the side of our face so we think that we're sleeping on our side. Pressure is how you create safety, and then just be able to get the conscious brain out of the way, and then that we have techniques that we talk about with it.
Yeah, that's super interesting. I'll have to try that with my 3.5-year-old. She comes in our room every single night and she's scared. Like she doesn't want to be in her room alone at night. She doesn't, we've tried like night lights, we've tried different things, but she's super snuggly, and I know it's only a season, so I don't mind her like coming in, but with 3, it's definitely chaotic. So both my girls, she came in last night, followed by my 2-year-old last night. And then like shortly after that, my 6-month-old got up and I had to nurse him. So it's just like a sleep chaos season. But normally my 2-year-old sleeps through the night, but the 3.5-year-old is up every night because she is scared. And so I'll have to try the superpower thing with her. But like, so you're talking about like sleep posture. Does the pillow matter? Like what kind of pillow we're sleeping on?
Yeah, so when I had that disc herniation, I tried to use all sorts of different cervical pillows and down pillows, and that's what we ended up using was a down pillow, but I kept jamming it underneath my neck in a way. We ended up designing a specific pillow called the Neck Nest. It's a pillow that's designed to to go underneath your neck and let the weight of your head hang off of the back of it, so it's about a half an inch off of the bed. So you don't want to support your head. That's the problem. Is a pillow defined as a support for your head? That's destroying your cervical curve because you can't support your head and support the neck at the same time. Because when you support the body, you make it whatever you're supporting weaker. So you want to use some sort of distraction force to stretch a curve back into your neck. So you need to, yes, you can support the neck, but at the same time, you don't want to support the head. You want the weight of the head kind of hanging off of the back of a pillow. Actually, I can show you. Is this a video?
Yeah.
Oh, okay, good. Perfect. So See right behind me?
Yeah.
So right here, this is a kind of neck nest that we have. So what you want to end up doing is you want to put the pillow underneath your neck, so the weight of the head is off of the back of the neck nest or the pillow
Hmm.
that you're using. And then that way, your subconscious brain right now is saying, no frigging way. I am not going to be able to do that. But that's because it's not a safe environment. And your conscious brain's like, I don't sleep like that. No way can I sleep like that. I try, I snore, I can't breathe. There's no way. I like to be snuggly bugly. Oh my, oh, so all the conscious brain is the one that's really giving you the pushback, because it knows the subconscious brain's trying to send signals of defense, and it's not a protective state. But if you put yourself in that position and then use pressure over your body, that's good. And the last thing I'm going to say about that is, I know I hate to break up marriages and relationships, but you should never share the same covers. You should, yep, you could put a duvet over the whole bed. That's fine. I love that. But never share the same covers as your spouse or sleeping partner, because they're a heater and you're a heater. The
Yeah.
body's temperature needs to drop by 1 to 2 degrees in order to get good deep sleep. You want your body temperature to only regulate under your own set of covers. So that's why I'm really firm on that with couples, is come together and do whatever you do at night, at the beginning of the night. But when it's sleep time, it's my time.
Yeah, that's interesting. I'll have to think about that this summer because my husband, he's a laborer and he works outside and he's outside like in the heat all summer and he is a furnace when he comes home. I feel like he is just radiating heat. And in the summer he gets obviously like super hot when he sleeps too, so he's like a no cover type of guy. Because he's just been working in 100-degree weather all day. Um, so it might work out though, because he, like I said, he doesn't really like use covers, so it'll just like be me. But in the winter, sometimes there are some tug of war every once in a while. Um, but usually, not. But he is a furnace. He does give off a lot of heat. Um, so I'll have to see how I can make that work.
No, I totally understand. But one of the issues is when you're using your covers, all you want to do is cover your core, and you want your hands out of the covers. So if you're sharing this cover and they're on that side, like you can't, like it doesn't work, right? So you want this, so your temperature regulates out your hands and your feet. You also want your feet exposed, and then that way your body can cool the temperature like it needs to.
I feel like I naturally do a lot of that.
Yeah.
I feel
It's
like I
good.
do.
And people that sleep well do. People that don't sleep well, those are the little tips that you can implement tonight. We're doing a sleep challenge. We do a quarterly sleep challenge for people. And one of the biggest things we do is we want to decrease pain. So we put the body into alignment. We want to create safety. So we use pressure. And then we want to establish good temperature regulation. So hands and your feet out of the covers and don't share covers.
Mm-hmm. I'd love for you to touch on kind of just like one more time, because like you talked about, that this helps you like in your, your accident that like you went through and going through sleep posture. Like how are you seeing this like play out in everyday life for people? Like fixing sleep posture, having them kind of like take on these techniques. You said there's like the 10-minute like bedtime routine thing that you get into, and then doing this sleep posture. Is this like actually like really creating differences in people's health?
Yeah, it's transformational. Where when I'm in private practice, really the biggest thing we're trying to do is establish healthy lifestyle rituals so that people can get their lives back. Like we're not like a big back and neck pain chiropractic office. We're a big health and function, where the brain controls everything through the body, through the nervous system, and your structure of your spine significantly plays a role in that health and well-being. So when we have good curves, those curves are the shock absorbers in our spine. So we'll maintain a nice straight spine, and the neurology is going to work seamlessly.
Mm-hmm.
As you lose the curve here, you're going to pick up this contorted spine. And what happens is you pick that up in dysfunction. So what we ended up doing is about 12 years ago, we started doing a measurement on people called heart rate variability.
Mm-hmm.
So heart rate variability, or HRV, looks at how your heart beats and will determine if you're sympathetic dominant or parasympathetic dominant. What's the balance within those systems? And the healthiest people had high heart rate variability, which means high variability or high parasympathetic tone. So we would adjust people, adjust people, adjust people. We're able to get that tone up temporarily, and then it drops. So their digestion issues are going away. Their autoimmune issues are getting better. Their allergies are getting better because they're becoming less hypersensitive. But it was so difficult as we went long periods of time without the adjustment to help people maintain that heart rate variability at these high levels, until we started working and focusing on sleep position as part of the lifestyle ritual that we add to our patient experience. So once we started changing the way people sleep, I basically put myself out of business because they need us less, because you're maintaining that alignment, and HRVs were staying up to where we wanted them, which is regulating the parasympathetic nervous system, which is where most people have the most difficult time when they have chronic illness. And then we started seeing real long, sustained changes.
Mm-hmm. Yeah, that's good. And I feel like that's kind of the point though. Like you shouldn't have to like continually always see people. I think that there's things like in our everyday life, um, like right now, being in a season where I am breastfeeding and doing a lot of bending over and whatever, like getting adjusted is nice for me. And we have like other everyday factors that for me, I like to get adjusted, but if there's like a chronic issue that's going on and you have to like continually get adjusted, I feel like there has to be some like underlying thing to like more look at, because then the adjustment is helping temporarily. But then if you're not continually doing it, then it's coming back. So I like that you guys were able to figure this out and to like help people, like you said, putting yourself out of business, because it's good to like give people those tools, and to find like more like root cause type stuff to help balance that parasympathetic system. I'm actually working with somebody right now who I didn't realize this. I'm just working on some like underlying health issues, and she put out like my whole routine that I'm supposed to do every single day. And it's more like foods to incorporate and some supplements. But then part of it was like, drainage and like dry brushing, and then before bed laying on my back and putting my feet up on the wall, and getting into, or like before I eat, taking some breaths, like trying to balance those systems out. And I didn't know that that would be part of this protocol. I thought she was just going to tell me like, here, like incorporate some of these foods. Let's maybe remove this for a little bit. Let's do some of this supplement to really support your liver and detox. And let's do this. But then it was like also like, okay, like take some deep breaths and really chew your food to activate your saliva to do this, and like make sure that we're unwinding before bed. And like she just emailed me all this week, so like I'm excited to start that because I know that that will like also make a difference. But we don't in our everyday lives like really think about, am I getting good enough sleep? Am I really like tapping into restorative rest? I think we just all think that like we're really busy and I got some sleep, so move on.
Yeah, that, the cause of the subluxation, which is the nerve pressure of the spine going out of alignment, there are three causes. One's physical stress, which everybody can, that's sleep position. Then there are two other causes, which people don't really realize. There's emotional stress and then biochemical stress. We just had a patient this morning who's doing absolutely fantastic. So good. I mean, she has significant disc degeneration and scoliosis, and she's a little older woman, but we have her back to, you know, on getting on the bicycle. She loves to do the bike and the spin classes. Then something emotional really happened with her daughter, who's living, you know, not close to here, and it's so emotional that she can't sleep now, and she's doing everything the same physically, but now all of the same pain symptoms came back. Nothing physically changed, but the emotional stress that she's under is manifesting in the physical world because neurology affects muscle tone, and muscle tone affects, you know, spinal alignment. So you have to understand, most people believe that the problem is in the muscles. It's never 90% of the problem is not the muscle. It's the muscle being told what to do by the neurology, and then understanding that aspect of what's going on. You know, you work on your core till you're blue in the face. You'll just have a strong core that's not innervated by the brain. You need to
Mm-hmm.
innovate the neurology by working on balance and changing sleeping position, and being able to spend 8 hours potentially in one position is a game changer for your overall health and well-being.
Mm-hmm. That's awesome. Can you maybe send me the link to that pillow so people listening, because
Sure.
a lot of people don't watch the video, they might just like be listening. So they can kind of like get a visual of what it is, maybe check it out. I definitely want to look into it. Because my husband and I have been on a hunt for like a perfect pillow. Oh, neck nest. Nice. Okay, perfect. I'll link it. My husband and I have been on the hunt for a perfect pillow for like 3 years, and we have tried so many different things to where he was like, whatever, I'm just going to keep my same old one. And I don't like super thick because then I feel like my head's like arching up. I don't like that. So I have a hard time like finding a good pillow, but I'll definitely look into that. And then for people who are listening, like maybe where can they learn more about what you're doing, the work that you do, and connect?
Yeah, so they can connect with me on either Instagram or Facebook at Dr. Sleep Right. So DrSleepRight, or they can go to my Dr. Sleep Right website, which is drsleepright.com. There, you can sign up for some of our sleep challenges. You can take a free sleep risk assessment. Basically, you take a questionnaire and it will rate how your sleep habits are affecting your health. And then from there, you can enter into one of our memberships, and that's pretty, you know, straightforward. All of my education is over at Dr. Sleep Right.
Okay, awesome. I want to thank you so much for coming on the podcast today and telling us all about sleep posture.
Thank you so much for having me.